Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 359. Coagulation disorders. What does prothrombin time test for? Prothrombin time, or PT, tests the function of the common and extrinsic coagulation pathway, so this includes factor 1, factor 2, factor 5, factor 7, and factor 10. What happens to prothrombin time if there is a defect in the extrinsic coagulation pathway? Prothrombin time, or PT, will be increased if there is a defect in the extrinsic coagulation pathway. What does partial thromboplastin time test for? Partial thromboplastin time tests the function of the common and intrinsic pathway, which includes all factors except factor 7 and factor 13. What happens to the partial thromboplastin time if there is a defect in the intrinsic coagulation pathway? With defect of the intrinsic coagulation pathway, there would be an elevation of the partial thromboplastin time. What is hemophilia A and hemophilia B? Hemophilias are the defect in the intrinsic coagulation pathway, and specifically hemophilia A is deficiency of the factor 8 in the intrinsic pathway, and hemophilia B is the deficiency of factor 9 of the intrinsic pathway. Describe what happens to the prothrombin time and the partial thromboplastin time in hemophilias. In hemophilias, there is no change in the prothrombin time because there is no effect in the common pathway and the extrinsic pathway, but there would be an elevation in the partial thromboplastin time, and the reason for this is because there is an effect on the intrinsic pathway due to the deficiency of factor 8 in hemophilia A and due to the deficiency of factor 9 in hemophilia B of the intrinsic pathway. What are some signs and symptoms of hemophilias? In hemophilias, you would observe macrohemorrhages, and this includes hemarthrosis, which is bleeding into the joints, easy bruising, and increase in that partial thromboplastin time. What is vitamin K deficiency? Vitamin K deficiency is a general coagulation defect which covers both intrinsic and extrinsic coagulation pathways, and this leads to a decrease in the synthesis of factors 2, factor 7, factor 9, factor 10, protein C, and protein S. Describe what happens to prothrombin time and partial thromboplastin time in vitamin K deficiency. Because vitamin K deficiency covers both intrinsic and extrinsic coagulation pathway, both the prothrombin time and partial thromboplastin time would both be increased.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEFasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEFasttrack.com.